Hi, my name is Dr. George Yakos. I've been a cardiologist for over 30 years, and I'm not representing any hospital system or corporation. I'm here to discuss the importance of informed consent. Informed consent is what distinguishes responsible public health care from dangerous, immoral, and unethical behavior, and at its worst can equate to medical torture and criminal activity. Misplaced trust in the healthcare and the pharmaceutical industry leads to shortcuts with terrible consequences. A proactive, informed health consumer is the only protection against intended and unintended consequences of medications and treatments. Cardiovascular disease is the #1 killer in the world. Does that mean we should put statins, blood thinners, and blood pressure medications in the water? That's nonsense. And if you believe that you should, and you don't think this is ridiculous, you lack informed consent. Medications being placed in the water supply without the foreknowledge of a consumer's overall health problems, nutritional status, their genetics, no matter how well-meaning, is irresponsible, criminal, and Dr. Mengele level science. You might ask what this has to do with fluoridation of the water supply. We spoke about the history, how Nazi camps and Russian camps used this to make their dissidents and their prisoners docile so that they wouldn't rebel against them and they could control them better. In the 40s, many people were around purporting the benefits of oral intake of fluoride. There was a Dr. Hodge that was mentioned earlier. He was the lead toxicologist of the Manhattan Project. This guy who used to do infomercials on the TV telling people fluoride is safe and effective. Sounds familiar, right? Safe and effective. And he basically would take prisoners and unwitting people and inject uranium, plutonium, and fluoride, a byproduct of what they were doing there, just to see what the impact was. And yet, this gentleman who found that there were terrible impacts on somebody's health was later purporting the benefits of oral intake of fluoride. The father of water fluoridation, Dr. Dean, was mentioned a little bit earlier, who found communities with naturally occurring fluoride in their water and there were benefits for the cavities, and then went on to do further, and a real scientist, he actually looked further to see if there was anything else wrong with fluoridation. So he decided to go to a community where there was more than the average amount of fluoride in water naturally. And he found people having huge prevalence of cataracts, huge prevalence of bony problems, vertebral problems, spine problems. And these were things that they were able to observe back then. So I want to ask people, how many people have somebody that they know that has had cataract surgery? So do you think the purported topical water that you drink that supposedly has topical benefit, because that's what we were told, that it's topical benefit from the water, not ingestion, the fluoride that destroys the microbe, the biome of your intestines, the fluoride that gets absorbed into your bloodstream, that it's only the topical thing that has any impact here? So a lot of ophthalmologists could potentially be put out of business if we could just take fluoride out of the water. Maybe. But there are other health effects besides worrying about cavities. So Dr. Dean was so excited about this information, he sought it out, and then when he became the proponent for the opposite side, his information got squashed. He would go to these other counties and talk about the dangers of water fluoridation, but got squashed. But he's still considered the father of fluoridation. That part survived. So, nonetheless, it's thought that the ingestion and the swallowing of water is helping you avoid tooth decay, and that the assumption that topical exposure to fluoride and that drinking the water is necessary, but topical is not good enough. So, as was just shown on the slides, the information that the dentist population was just presenting us, where there's no IQ reduction, is complete nonsense. In fact, we, as the United States, have sought to find out if these Canadian and Mexican studies that showed significant reductions in the IQs of children are true. And the information's been available for over a year, getting squashed, getting suppressed by Dr. Rachel Levine. And we have to do Freedom of Information Act releases just to find out that 72 studies have confirmed that there is IQ reductions in children. And now we have to wait till next week before that information gets released from a few years ago. So this constant repeating, it doesn't reduce IQ, I think is a lie, honestly. So that being said, They do not know the upper limit of safe fluoride ingestion. Whether it's 1.7 or 8 parts per million, no one knows. It was admitted during these depositions. The predominant benefit of fluoride is from topical application. That was admitted during these depositions. There was never any proof that ingestion of fluoride made a difference in caries, as our European counterparts have told us. Ingestion of fluoride has adverse effects on the brain, the thyroid, the pineal gland. The pineal gland has one other function we didn't mention here. It's our God antenna. You know, you calcify that, you actually impact people's religious fervor. That's pretty interesting. The National Toxicology Program confirmed the whole issue with IQ degradation, and dental fluorosis, which is being shown here, is present in 80% of the public and represents toxic exposure to fluoride, not topically, because you absorbed it and it went everywhere. How about some other candies that we gave in medicine that are really good? Prozac, Luvox, all have fluoride in them. You know, that mineral that supposedly is beneficial is actually a chemical compound that dampens your brain's function. Fen-phen destroyed the heart. Roofies, the date rape drug, fluoride had that impact on your memory. So make no mistake, fluoridating water is forced medication of the public without consent. Thank you.